Thank you, Gail. The mission of the ALS Association is to lead the fight to cure and treat ALS through global cutting-edge research and to empower people with Lou Gehrig's disease and their families to live fuller lives by providing them with compassionate care and support. So I'm going to follow Gail's presentation with giving you some general information regarding the chapter and the resources that we offer. Our service area is a fairly large area covering eastern Pennsylvania up to the Harrisburg border and east, southern New Jersey, going from Cape May County up to Monmouth, and the entire state of Delaware. This is a map of our region to help guide you to the geographies that we're able to provide services and care to patients, families, and professionals in the community. Our chapter's history is an interesting one. We were established in 1977, and it started with a very single support group, which was participated by our current president of the Greater Philadelphia chapter, Ellen Phillips. We became the principal charity of the Phillies and have been since 1984, and we are very fortunate for a very reciprocal and mutual relationship. Funding for all direct services, research, is achieved primarily through private donations and fundraising efforts on behalf of the chapter. Our patient services programs are vast, and we're very fortunate to have an excellent service and care provided by the variety of professionals we have on our staff. We have support and staff at 2 multidisciplinary clinics, one at the Hershey Medical Center and one at Pennsylvania Hospital. We offer a variety of educational programs, including a newly diagnosed seminar in several of our geographies, research symposiums, newsletters, and teleconferences. We offer transportation to the best of our ability in particular geographies that include wheelchair-accessible vans that have the ability to transport people that are utilizing BiPAP and/or ventilators. We have an extensive durable medical loaner program that provides durable medical equipment, including wheelchairs, tub benches, transfer equipment, commodes, and lift chairs. Our accessibility program specifically will address safety and accessibility getting in and out of one's home, so we try to assist patients and families with ramps, stair glides, and emergency call devices. Our assistive technology program is unique. We have a specific assistive technologist that will evaluate individuals that might need a communication device or adapted equipment when they're no longer physically able to utilize their hands. Our home care services are limited, but they can be very useful to patients and family to provide a minimal amount of services each week, specifically for personal care and bathing to give the caregiver a break. Our respite services, again, we have a particular amount of hours that we try to provide for our families that are dealing with ventilator dependency and/or our non-ventilator dependency families to give the identified caregiver the opportunity to get a break. Home visits are provided as needed. Our nurses, social worker, assistive technologists, and mental health nurses can provide home visits where needed. We have a variety of resource groups that are offered on a monthly basis, some specifically for patients and families, men who are caregivers, female patients, and a general caregiver quarterly group. We try to provide our groups in all of our geography. Our visiting volunteer program is a unique program where we match up someone that has had a personal experience with ALS. We train them, provide them with support, and connect them with a patient that is currently coping with the disease. Our recreational programs are also offered throughout our geography and will provide a great day for a patient and 3 guests to Longwood Gardens or our really fun holiday party during the holiday season. The ALS Association Greater Philadelphia chapter is very dedicated to the entire concept of research and advocacy on behalf of patients and families. The National ALS Association currently funds more than 100 different diverse research studies worldwide, and there are specific clinical trials offered at our clinics. The chapter supports over $500,000 annually towards research throughout the national organization. Advocacy is one of our major thrusts to make sure that ongoing services are provided and that in large ALS is known as a disease that is occurring in the population. So we advocate for a variety of legislation so that ALS patients can gain access to specific resources. For example, our patients now do not have to wait 2 years for Medicare. And in addition to that, veterans that are diagnosed with ALS, as of 2009, it was identified that more than 2 times the amount of the population that were being diagnosed with ALS were veterans. So we now work very closely with the Veterans Administration to access financial and concrete resources for our patients that have ALS that are veterans. How do you refer a patient to us? It's a fairly simple process. Basically, we have 2 criteria. The patient needs to live in our geography, and we need either the patient themselves or the next of kin to call in to the Greater Philadelphia chapter office, ask for a representative from Patient Services, and we just need to confirm that the diagnosis is definitively ALS. So as you can see on our screen, you would contact the chapter office at 215-643-5434 and ask for a representative from Patient Services. At this point, we want to thank you for taking the time to watch this DVD today and learn more about the symptomatology, treatment, management of ALS, as well as the services and the resources that the chapter provides. If you have further questions and concerns, we welcome you to contact either myself, Brenda Edelman, I'm the Director of Patient Services for ALS, Brenda at alsphiladelphia.org, 215-643-5434, or please contact Gail Hausman, the Regional Nurse Coordinator for the chapter, Gail at alsphiladelphia.org, or at 215-643-5434, and hopefully any questions or concerns you have about caring for a patient diagnosed with ALS can be resolved. Thank you again.